Our first speaker today is Dr. Paul Fortin. In addition to being a senior scientist at Arthritis Research Canada, Dr. Fortin is a full tenured professor of medicine at Université Laval and a clinical researcher at the Centre de Recherche du CHU de Québec, Université Laval in Quebec City, where he is actively building up research capacity in clinical rheumatology and a unique research program on systemic autoimmune rheumatic diseases, SARD. He is interested in biopsychosocial impact of chronic rheumatic diseases, a model that attributes disease outcome to a broad range of factors, including biological, psychological, and social. Dr. Fortin's presentation is on managing lupus and you. Navigate your journey with My Lupus Guide. Dr. Paul Fortin. Thank you.
Thank you very much, Mr. Collins, and thank you for APAB for this invitation to come to ROAR 2017. This is my first presence in 11 years, hopefully not my last. Managing arthritis and you. So I thought, why not talk about what my research area is managing lupus and you, how to navigate your journey with My Lupus Guide. And, you know, it's not everyone in this room or on the web that has lupus. I think every time I say lupus, you could change that diagnosis for your own disease, because what I'm going to be talking about today is really applicable to any type of chronic disease. So, some conflicts of interest. I'm going to be presenting to you a website that has been developed with a company that has expertise in IT, which is called Jag Digital Productions. I have served on 3 advisory boards on lupus in the last 2 years, and we do some research grants with these companies. So, I think if there's one thing you want to remember from my talk this morning is this quote from Jane Austen from hundreds of years ago. When she wrote in Mansfield Park, "We have all a better guide in ourselves, if we would attend to it, than any other person can be." And that hopefully will be what will come out of this talk this morning. So, living with lupus is a lifelong contract, and it becomes part of you. However, it does not have to control you, all of the opposite. And I'm going to be using an image that I often use with my patients in the next 4 slides to try to illustrate what happens with a chronic disease. The first thing, I want you to imagine that this is a computer screen, but that computer screen is an allegory for your life. And if you're just diagnosed with a chronic disease like lupus, which I exemplify here as a butterfly, which is a symbol for lupus, as soon as you get a diagnosis of a chronic disease like this, you start feeling that this is invading your whole life. It's occupying the whole screen. And the Windows comparison is helpful sometimes to try to explain where we want to get with the treatment of a chronic disease and the partnership we need to establish with you as a patient. So with time, with treatments, with partnership with your healthcare team, what the goal is, obviously, is to control the disease and minimize its impact in your life. And as Windows can do, you could start feeling that the screen gets smaller, the windows of lupus get smaller, and all of a sudden, in the background, you start seeing what your usual activities and your usual life would be. And if we're successful, we'll get that windows much smaller. That little windows now is appearing on your left corner. And this is my son, Adrian. When I asked him, how would you do a picture of embracing life? He just went up like this with his arms. And really the goal, ultimately, is that the windows becomes a tiny little icon, because then it reveals the rest of the icons of your life, your family life, your work activities, your social endeavors, and it doesn't have to control you. But there's a long way between that first screen that occupies all of your screen, that first image, to this item where there's only an icon. So the other notion I want to bring with you is the perspective from the physicians of the healthcare team of what the impact they have on how you manage your lupus. And recently I was to a meeting with patients with lupus and physicians, and we were asking them, what do you think is the impact of your physicians when you make decisions about lupus? And there was a big discordance. Physicians thought at least 50% of what will go into making a decision will come from the physician's explanations or recommendations. And patients said, no, I'm 20 minutes or 30 minutes in the physician's office here and there, and the rest of my life is spent with my family, my spouse, my friends, my work environment. I go on the web. I get information from many, many different sources, and the importance was much lower. The other notion I want to bring up is how difficult sometimes it is to navigate the healthcare system currently. So if you have a chronic disease that's unusual like lupus, you will end up probably having a rheumatologist in the community. You may have a lupus clinic. You will have to have tests done at different hospitals or healthcare facilities. And then all of these healthcare providers will refer you to different specialists, and it becomes like what I describe as spaghetti graph, right? Where you have curves crossing and you can sometimes get lost into that system. But worse is that this could become a barrier to other services that you really need, which is accompanying you with the help of a pharmacist. Exercise. Should I exercise when I have lupus? Yes, but how do I start? What about work in lupus? What about nutrition? So all of these services, there is a barrier sometimes between how busy you are with the medical system and accessing these resources that are not so available. So would you prefer maybe a system that would allow you to get all of these services in a centralized space? So where you could get in a lupus center or in a center where you have specialists on exercise, nutrition, psychosocial counseling, mindfulness. And if this would happen, you would maybe want to have a reminder at home, somewhere you can go on the web that is a pillar to reinforce what you can do and make decisions, which is really what the Lupus Guide is trying to do. So My Lupus Guide has been developed with the goal to provide reliable and easily accessible information to persons with lupus. But why is this necessary? Obviously, if people with lupus had no issues, we wouldn't have to think of a way to help further. So there are unmet needs of people with lupus that mandates that we seek change in how we approach care of lupus. Unfortunately, there's still a disproportion. It is small, but there's still a disproportion in terms of mortality around the time of diagnosis. So making a diagnosis rapidly will prevent the disease from getting uncontrolled or prevent sometimes infections. And sometimes with later disease, there's a slight increased risk in cardiovascular disease. More importantly, maybe, is that we realize when we surveyed the centers across Canada that about a third of lupus patients do not have an adequate control of their disease activity. And what the ultimate result is for people living with lupus is the quality of life, when we do surveys, remains lower than the general population and sometimes comparable to other severe chronic disease in older people. So, we are aiming for more empowerment of the patient, and we are aiming towards person-centered care, and the philosophy behind building up My Lupus Guide was based on this. This is one of the best definitions I found from the UK of what is person-centered care. It's a way of thinking and doing things that sees the people using health and social services as equal partners in planning, developing, and monitoring care to make sure it meets their needs. This means putting people and their families at the center of decision and seeing them as experts, working alongside professionals to get the best outcome. So, lupus itself is a relatively infrequent disease, so it is not as well known in the public, and there is little reliable information readily available or disseminated to those living with lupus and their families. By being better informed, we believe that My Lupus Guide can help people living with lupus navigate the road towards better health and being better equipped to make their choices and their decisions. So, I mentioned earlier that we had a partner called Jag Digital Productions. This is a company that had developed a oncology interactive navigator. Some issues even though it's not arthritis, are common to all sorts of chronic diseases. Cancer has become a chronic disease, and the most difficult period is usually what the cancer people will call the survivorship period, which is once the active treatment is done, people are left with the perspective, we'll see you in 3 months or in 6 months, and we'll just make sure your cancer is not back. This is a totally different perspective than active treatment when you're actually doing something to cure yourself. So this was a need, and people realized that this could not be delivered by hospital, was better done by patients themselves, by informing them. So there's a whole series of interactive navigators in oncology, and so we tapped on that expertise. What the guide, the oncology guide, and now My Lupus guide is trying is to support healthcare providers. It customizes protocols, processes, and practices. It supports standardized, patient-friendly communications. It is efficiently integrated with a clinical environment. It encourages patient activation and self-management. It's cost-effective and efficient to use since it can be accessed at home. And it's a platform for ongoing research. From the patients, the goal is to improve the patient's experience as it engages the patient and their families. It addresses diverse information needs. It allows access to care even in outreach areas. It is available when the patient is ready. If they have a question at midnight on Saturday, the rheumatologist is usually not available, but they could go on the web and try to find the answer to their question. It's comprehensive because there are fields that are addressing decision-making, illness management, self-management, follow-up care, and survivorship care plans. And it also brings care closer to home, so if you enter your postal code, you can find out the resources in your geographic area. So we sought funding from public funders. The Canadian Institute of Health Research responded in a knowledge transfer grant. And so there was a process that we followed to create My Lupus Guide. The first thing is we did some researching in trying to make sure we would have reliable information. But more important than that, we went back to try to define what are the unmet needs of patients with lupus and of their healthcare providers. So we held focus groups across the country with patients, with rheumatologists, and with allied healthcare professionals, specialists in arthritis. From that, we built up a table of content that we thought people needed, and we went to the experts editor, the editorial team from Jag Digital Productions to get into the production of a first draft of a lupus guide. But we were not contented with that, and we wanted to validate that first draft, so we went back to 5 centers in Canada and about 37 patients that we had a validation phase to revise the lupus guide so it would meet with this final version that we have now. So if we summarize, there were 3 steps through the Canadian Institute of Health Research grant, the focus groups, and in that focus group, we had 29 persons living with lupus in 4 groups. We had 20 rheumatologists in 3 groups and 8 allied health professionals in 1 group. We had a second intermediate steps where we actually had built the table of content and wanted to validate these were the fields most people would think are important to bring in the lupus guide. So we had surveys conducted in collaboration with Lupus Canada, and we reached out with 665 patients answering that survey, 98 rheumatologists from the Canadian Rheumatology Association, and 74 arthritis allied health professionals. And that last step, once the lupus guide was done, was conducted for validation in 37 patients. So how does it look like now? We do have a product. The lupus guide front page would look like this. And there are many ways to navigate this. The bigger section, the middle section, you see buttons where it's easy to just click and you can access to information. And they group into a theme. So the first theme is, I have lupus, what's next? The second one, where can I find support? Living well with lupus, learn more about the disease. And there's also a section, I know someone with lupus, how can I help someone with lupus? You could also use the top titles with scroll-down menus to access different information. And you see on the right-hand side, there's this lupus toolbox. Some of these sections have to be developed, but there could be links done with your electronic medical records. There are printable help sheets. If someone is nervous about an encounter with a physician, they could prepare, and the print sheet can be helping with what needs to be addressed with the physician or the healthcare professional. And there are other information. So we now have a lupus-specific website with different approach. We can have patients' videos. We have healthcare professionals relating also on a video some issues. And there are other information on laboratory tests, treatments, complementary medicine, and so on. So we are now at the last phase, and that's why it's very exciting, because next week we're going to be disseminating My Lupus Guide. Through another grant, we want to learn what the impact might be. So the Canadian Institute of Health Research gave us another grant called Knowledge to Action. And this grant is asking whether persons with lupus will use and uptake the information and services of My Lupus Guide on a regular basis, and whether this uptake will be associated with better self-management, improved coping, higher sense of control over their life, and overall improved health. So in my last slide, I want to bring this idea that we could have a lupus platform, it could be an arthritis platform, where we would integrate at-home service like My Lupus Guide, where we would integrate this hopefully with an electronic medical record, and there could be a section for research. In ending, I want to thank the funding organizations that helped with this study, my team in Quebec City that are assisting me, that reflects the demographic of the lupus population, young women, and also Dr. Deborah DaCosta, who's a co-principal investigator on this at McGill University and who's a health psychologist. So thank you. I think we have a few minutes for questions. Maybe a microphone here.
Thanks so much for your presentation. It seems like you've got this beautiful product and wonderful information, and I think you started to allude to it in your last slide there, but sort of two questions in terms of behavior. So one is, how do you get patients to go and access that information? And two, once they've accessed that information, how do you sustain the behavior for them to self-regulate and actually use that information? So in other words, how do you bring the horse to water as well as make them drink?
Mm-hmm. So the first questions, the model in oncology is linked to the oncology centers. This is not the model we want for lupus because we don't feel we have the same resources and structure for delivering care to lupus patients. We want this to be available through the web without any restrictions. Now, that doesn't prevent from specialized lupus centers to encourage and maybe lead the way by showing how to access this information and link in many ways to the lupus guide. So in the second half of 2018, we're expecting that this would be available live on the web. The second question, obviously, is the question that we will study in this latter part of the study, which is this a sustained interest of patients with lupus to actually go back to this website? Well, there are two things there. When we did our support, our focus groups, we realized that the needs change according to when was your diagnosis made. And so there is a lot of needs that are specific to the diagnostic period or, investigation period and early treatments that are very different from patients who had the disease that said, oh, it's been 15 years, I have developed my own tools. And their needs were more maybe vocational, work, family issues. They were not as much medical. So we have always room for improvement in a website. And I think what makes a website interesting is that it changes and it becomes interactive. So we're making sure we have a box where we get suggestions from people to how to change it and improve it. We'll have to make sure that the information is maintained, but we're also trying to add, which is not presently there, a timeline. So people, when they come in, can say, well, I've been having lupus for 10 years, and maybe the information that's focused for that group of people will be different than if they say, I've been just diagnosed. Thank you.